12 Unusual Symptoms of Diabetes. Hello, in today's Your Health episode we are going to address a topic that affects millions of Brazilians: diabetes. You've probably already heard about the classic symptoms such as excessive thirst, frequent urination, and high blood sugar. You've probably already heard about the classic symptoms such as excessive thirst, frequent urination, and high blood sugar. But did you know that there are other, less-known signs that may also indicate the presence of this silent disease? Recognizing these signs early on can make all the difference in diagnosis and disease management. In this episode, we'll explore 12 of these unusual symptoms that deserve your attention. Stay with us and take care of yourself. Number 1. Skin darkening around the neck. Skin darkening, especially in the neck region, is a rarely discussed symptom, but one that may be an important warning sign for type 2 diabetes or prediabetes. This condition is known as acanthosis nigricans and is characterized by the appearance of dark patches, usually brown or black, with thick, velvety, and sometimes rough texture. These changes tend to appear in skin folds such as the armpits, groin, elbows, knees, and more frequently on the back of the neck. The main cause is related to insulin resistance, when the body's cells stop responding properly to the hormone. In response, the body produces more insulin, which stimulates excessive skin cell growth and increased pigmentation. Although it is strongly associated with type 2 diabetes, acanthosis nigricans may also appear in people with obesity, hormonal disorders, such as polycystic ovary syndrome, or as a side effect of medications like corticosteroids and contraceptives. The sudden appearance of these spots should be investigated. Consulting a physician is essential to determine the cause and, if needed, begin lifestyle changes. Early diagnosis can help control blood sugar and prevent progression to diabetes. In this case, the skin works as a mirror reflecting your metabolic health. Number 2. Dizziness. Dizziness is a less commonly discussed but highly relevant symptom that can be directly linked to diabetes. This sense of imbalance typically happens when blood glucose levels fall outside the ideal range, whether too high, hyperglycemia, or too low, hypoglycemia. In hypoglycemia, defined as blood glucose levels below 70 milligrams per deciliter, the brain, which relies on glucose as its main energy source, does not get the necessary fuel. This affects brain function and can cause dizziness, blurred vision, cold sweats, tremors, difficulty concentrating, and in more severe cases, loss of consciousness. Hypoglycemia is common in situations like prolonged fasting, incorrect use of insulin, or intense physical activity without appropriate nutritional adjustment. On the other hand, hyperglycemia, where blood sugar levels are too high, can also lead to dizziness, especially when accompanied by dehydration or diabetic ketoacidosis. In this state, the body starts burning fat for energy, producing ketones in the blood. These acidify the body and cause symptoms like nausea, vomiting, rapid breathing, and sweet-smelling breath. Dizziness should therefore be closely monitored. If it becomes frequent, checking blood sugar and seeking medical evaluation is important. Identifying whether the cause is hypoglycemia or hyperglycemia is essential for correcting the issue quickly and preventing more serious diabetes-related complications. Number 3. Frequent infections. One of the lesser-known but very relevant symptoms of diabetes is increased susceptibility to recurrent infections. When blood sugar levels remain high over time, the immune system becomes less efficient. This happens because excess sugar directly interferes with the activity of white blood cells, the body's main defense against viruses, bacteria, and fungi. With a weakened immune system, the body becomes more vulnerable to various types of infections which may occur more frequently and more intensely. Among the most common are vaginal candidiasis, a fungal infection causing itching, thick discharge, and discomfort, and urinary tract infections which may affect the bladder, urethra, and in more severe cases, kidneys. Skin infections like boils, cellulitis, and fungal infections are also common, as well as respiratory infections such as colds, bronchitis, and pneumonia. Another important point is that people with diabetes often recover more slowly from these infections. Chronic hyperglycemia impairs blood circulation, reducing the delivery of oxygen and nutrients to cells. This hinders healing and the body's ability to fight off pathogens, increasing the risk of complications, especially when treatment is not started early. Number 4. Irritability. Irritability, often viewed as a common emotional reaction, may actually be a significant symptom of diabetes. Fluctuations in blood glucose levels, both highs and lows, can directly affect the brain and significantly influence mood. Hypoglycemia, which occurs when blood sugar falls below 70 milligrams per deciliter, disrupts the brain's energy supply, impairing cognitive and emotional function. As a result, a person may feel irritable, anxious, impatient, or even display aggressive or confused behavior. In children and adolescents, this irritability is often more noticeable, with sudden mood swings and difficulty focusing. Meanwhile, hyperglycemia, excess sugar in the blood, can also affect emotional state, causing fatigue, apathy, discomfort, and greater emotional sensitivity. When these fluctuations go uncorrected, they can severely impact quality of life, relationships, and daily activities. Frequent mood swings, especially when accompanied by signs like excessive hunger, headache, sweating, or extreme tiredness, should not be ignored. They may indicate blood sugar imbalances. Regular glucose monitoring, a balanced diet, and following medical guidance are crucial for maintaining emotional stability and avoiding complications. Recognizing irritability as a symptom is fundamental to achieving effective and compassionate treatment. Number 5. Vision changes. Changes in vision are symptoms that are often overlooked but may indicate the presence or worsening of diabetes. One of the earliest visual complaints reported by people with high blood sugar levels is blurred vision. This occurs because excess glucose disrupts the balance of fluids within the eye, directly affecting the shape of the natural lens, the crystalline. This temporary distortion changes the eye's focus, causing difficulty seeing clearly both near and far. In addition to blurry vision, individuals with diabetes may notice they need to change their glasses or contact lenses more often than usual. This instability in visual sharpness is a direct result of blood sugar fluctuations. Diabetes also increases the risk of developing more serious eye problems at an earlier age. One of them is cataracts, which make the lens cloudy and reduce visual clarity. Another is glaucoma, a condition that damages the optic nerve, usually due to increased intraocular pressure and may lead to progressive vision loss. The most concerning complication, however, is diabetic retinopathy. This condition damages the blood vessels in the retina, the layer responsible for capturing light and forming images. If left untreated, retinopathy may progress to irreversible blindness. Therefore, any change in vision should be taken seriously. Regular eye exams and strict blood glucose control are essential for protecting eye health and preventing visual complications related to diabetes. Number 6. Sexual dysfunction. Sexual dysfunction is a symptom often kept quiet but may be directly linked to diabetes, especially when the disease is poorly managed. Men with type 2 diabetes are more likely to develop erectile dysfunction, a condition that makes it difficult to achieve or maintain a satisfactory erection. This occurs mainly due to damage caused by chronic hyperglycemia to the nerves and blood vessels responsible for penile blood flow. In addition, emotional factors such as stress, anxiety, and low self-esteem, often associated with living with a chronic illness, can also contribute to erectile dysfunction. In many cases, this symptom is the first clinical sign that leads a man to seek medical help, revealing a case of previously undiagnosed diabetes. In women, the impact of diabetes on sexual function is less discussed but equally important. There may be decreased libido, vaginal dryness, pain during intercourse, and difficulty reaching orgasm. These symptoms are linked to neuropathy and reduced natural lubrication in the vaginal mucosa, as well as possible hormonal and emotional imbalances caused by the disease. Sexual dysfunction in both sexes may significantly affect quality of life and emotional well-being. Therefore, it is essential for this issue to be addressed openly and supportively during medical appointments. Proper blood sugar control, lifestyle changes, and when needed, specific medications can greatly improve the sexual health of people with diabetes. Talking about the issue is the first step toward finding solutions and improving quality of life. Number 7. Dry skin and itching. The skin is one of the organs most affected by the metabolic changes caused by diabetes, and symptoms such as dryness and itching can be important indicators of the disease. When blood glucose levels remain high over a long period, known as hyperglycemia, the body tends to lose excess fluids through urine. This process leads to dehydration, which directly impacts the skin's natural moisture, making it drier, rougher, and more prone to cracking. The areas most frequently affected are the legs, feet, and around the ankles, where the skin is naturally more sensitive and less hydrated. Lack of moisture in these areas makes it easier for itching, irritation, and even skin infections to occur, especially if scratching or constant friction causes lesions. Besides dryness, itching may also result from diabetic neuropathy, a common complication of poorly controlled diabetes. Neuropathy happens when peripheral nerves are damaged by elevated glucose, leading to abnormal sensations in the skin, such as tingling, burning, and pruritus, itching. These symptoms can be persistent and very uncomfortable, interfering with sleep and overall quality of life. Number 8. Fruity smelling breath. An unusual yet quite characteristic sign of advanced or uncontrolled diabetes is fruity smelling breath. This odor, which may resemble overripe fruit or even acetone, is a sign of a serious condition called diabetic ketoacidosis. This condition mainly affects people with type 1 diabetes when there is a severe insulin deficiency in the body. Insulin is the hormone responsible for allowing glucose to enter cells to be used as energy. When there is not enough insulin, the body cannot use available glucose and starts breaking down fat stores for energy. This process produces ketone bodies, acidic substances that accumulate in the blood. One of these compounds is acetone, which, when expelled through the lungs, gives the breath its sweet and fruity smell. In addition to the odor, diabetic ketoacidosis is usually accompanied by other concerning symptoms such as nausea, vomiting, abdominal pain, rapid breathing, mental confusion, and, in more severe cases, loss of consciousness. This is a medical emergency that requires immediate hospital care, as it can quickly lead to diabetic coma and pose a life-threatening risk. Noticing this kind of breath, especially if combined with other signs of decompensation, demands urgent medical attention. Number 9. Dry mouth. Dry mouth, also known as xerostomia, is a symptom often overlooked but one that may indicate poor blood sugar control associated with diabetes. When this sensation becomes frequent or persistent, it deserves special attention. The main cause is hyperglycemia, that is, high levels of glucose in the blood, which directly affects saliva production. High glucose compromises the functioning of the salivary glands, reducing saliva secretion. This leaves the mouth dry, sticky, and more exposed to problems like cavities, gingivitis, bad breath, and fungal infections such as oral candidiasis. Saliva is essential not only for keeping the mouth moist, but also for aiding digestion and protecting the mucosa against infectious agents. Another important factor is polyuria, an increase in urinary frequency caused by excess sugar in the blood. The body tries to eliminate this excess glucose through urine, which leads to fluid loss and further worsens dehydration, aggravating dry mouth. In addition, certain medications used to treat diabetes, such as diuretics and oral anti-diabetic drugs, can also reduce saliva production. When constant dry mouth interferes with eating, sleep, and quality of life. Therefore, it is essential to stay hydrated, keep blood sugar under control, and seek both medical and dental guidance to prevent more serious complications. Number 10. Limb pain. Pain in the limbs is a common symptom, though often misinterpreted, and may be associated with diabetes. This pain is typically caused by a complication called diabetic neuropathy, nerve damage caused by prolonged exposure to high levels of glucose in the blood. The most common form is peripheral neuropathy, which primarily affects the feet and hands. The most reported symptoms include burning, tingling, numbness, electric shock-like sensations, and sharp or stabbing pain. These sensations usually worsen at night and may interfere with sleep and daily activities. In more advanced stages, loss of sensation in the feet can become so severe that small injuries go unnoticed, progressing to infections or hard-to-heal wounds. In addition to peripheral neuropathy, there are other types of neuropathy that also cause pain in specific body regions. Proximal neuropathy, for example, affects nerves in the lower back, thighs, hips, and buttocks, causing intense pain and muscle weakness. Focal neuropathy affects isolated nerves and may cause sudden pain in the wrists, legs, or even the face. Finally, autonomic neuropathy affects the nerves that control automatic body functions such as digestion, heart rate, and blood pressure, causing internal symptoms and, in some cases, abdominal pain or vague discomfort. The most reported symptoms include burning, tingling, numbness, electric shock-like sensations, and sharp or stabbing pain. These sensations usually worsen at night and may interfere with sleep and daily activities. In more advanced stages, loss of sensation in the feet can become so severe that small injuries go unnoticed, progressing to infections or hard-to-heal wounds. In addition to peripheral neuropathy, there are other types of neuropathy that also cause pain in specific body regions. Proximal neuropathy, for example, affects nerves in the lower back, thighs, hips, and buttocks, causing intense pain and muscle weakness. Focal neuropathy affects isolated nerves and may cause sudden pain in the wrists, legs, or even the face. Finally, autonomic neuropathy affects the nerves that control automatic body functions such as digestion, heart rate, and blood pressure, causing internal symptoms, and in some cases, abdominal pain or vague discomfort. Number 11. Unexplained weight loss. Unexpected weight loss, even with a normal or increased food intake, may be one of the first warning signs of diabetes, especially type 1. This symptom can also occur in advanced stages or poorly controlled cases of type 2 diabetes. It appears when the body, due to a lack of insulin or its poor performance, cannot use glucose as an energy source. Without access to glucose, the body begins to consume its internal energy stores. It first uses stored fat and then muscle mass. This process leads to progressive weight loss and reduction of lean mass, even when the person is not on a diet. It is common for this weight loss to be accompanied by extreme fatigue, weakness, irritability, and a constant feeling of hunger. In children and adolescents, this weight loss usually happens quickly and visibly, and is often what leads to a type 1 diabetes diagnosis. Sudden weight loss, especially if associated with other symptoms like excessive thirst, frequent urination, and constant fatigue, should be investigated. Early identification of diabetes is essential to begin appropriate treatment, stabilize blood glucose levels, and prevent serious complications such as malnutrition, ketosis, and loss of metabolic function. Number 12. Nausea, and vomiting. Nausea and vomiting may seem like common digestive issues, but in the context of diabetes, they can signal serious imbalances in the body. One of the main causes of these symptoms in people with diabetes is autonomic neuropathy, a complication that affects the nerves responsible for involuntary body functions, such as digestive system movements. When autonomic neuropathy affects the stomach, it can cause a condition known as gastroparesis, characterized by delayed gastric emptying. This means that food remains longer in the stomach, leading to a feeling of fullness, persistent nausea, bloating, reflux, and in more severe cases, vomiting of undigested food. This condition directly interferes with nutrient absorption and blood sugar control, since glucose release into the bloodstream becomes unpredictable. In addition to gastroparesis, hyperglycemia, elevated blood glucose levels may also contribute to nausea and vomiting, especially when combined with dehydration. The situation becomes even more severe in cases of diabetic ketoacidosis, a medical emergency where the buildup of ketones in the blood causes acidosis, with symptoms such as abdominal pain, intense nausea, vomiting, rapid breathing, and fruity-smelling breath. On the other hand, in hypoglycemia, while nausea is less common, the patient may present with other symptoms such as sweating, tremors, irritability, and mental confusion. If nausea or vomiting persists without an apparent cause, especially in people with diabetes, medical evaluation is essential. Appropriate treatment can prevent serious complications and significantly improve the patient's comfort and quality of life. Updates from 2025. More than half of all people with type 2 diabetes show some form of skin condition, such as diabetic dermopathy, necrobiosis, lipoidica, or dry skin, according to a Healthline review updated on May 19, 2025. These skin changes, including ulcers, cracks, and delayed healing, are often the first visible signs of the disease. Acanthosis, nigricans, dark, velvety patches on the neck, armpits, groin, and skin folds remains one of the most common early visual signs of insulin resistance. According to DermNet and Wikipedia, this condition represents a biological response to hyperinsulinemia, leading to keratinocyte and skin fiber proliferation. Healthline highlights that identifying these patches should prompt investigation for diabetes or prediabetes. Additionally, necrobiosis lipoidica diabeticorum is another skin condition linked to diabetes, causing yellowish plaques, purplish borders, especially on the shins. In a recent study from 2025, this condition was found in approximately 64% of necrobiosis cases, reinforcing its connection to diabetes. These findings strengthen the idea that skin acts as a true metabolic mirror. Seemingly simple skin changes may reveal underlying insulin resistance and diabetes. If you notice dark patches, cracks that will not heal, or lesions like these, it is worth seeking medical evaluation. Early identification and treatment of these skin manifestations may lead to earlier diagnosis, quicker disease control, and prevention of more serious complications. These listed symptoms are not always immediately associated with diabetes, but they may signal decompensation or disease-related complications. If you notice any of them, seek a healthcare professional for early investigation. Timely diagnosis and treatment can prevent serious consequences such as blindness, neuropathy, cardiovascular disease, and ketoacidosis. Also discuss prevention and control measures such as proper nutrition, regular physical activity, blood glucose regulation, and routine testing. So, did you already know about these lesser-known diabetes symptoms? Paying attention to these signs can make a big difference in early diagnosis and disease management. If you recognize any of them in yourself or someone close to you, do not hesitate to seek a healthcare professional. Thank you for staying with us until the end. If you found this content useful, like the video, share it with someone who needs to hear this, and subscribe to the TU Salud channel for more reliable information on health and well-being.